Hello and welcome to this is going to be our anatomy, our gross anatomy portion of part one chiropractic boards. So, the way that this is going to be divided up is we're going to see the general themes. So, for example, topographical anatomy. This is going to represent 11% of the overall content within gross anatomy. General anatomy also makes up about 22, makes up 20% of our overall exam. So, for example, 11%, 20%, if we do some quick math, there's 255 questions. 51 of them are going to come from general anatomy, and about 5 or 6 questions will come from the topographical anatomy section. As we go through the anatomy section, I'm going to point out a lot of stuff that, to be quite frank, is just raw memorization type material. I'm not going to spend a lot of time on that material itself because at the end of the day, me reading off, the action, origin, and insertion of every single thing is not going to be helpful. What we will do instead, though, is take some of those charts, and I'll show you a couple of different ways that you can go through them, kind of learn from them, as well as I haven't fully decided yet if they're going to be a full Quizlet, including all of that information. As again, yes, you could spend a lot of time doing that, but unless you're out prepping for boards 6 months in advance, which some of you might be doing so, and if so, kudos to you. But it's not necessarily worth all of our time to just memorize a lot of raw memorization type material just for the sake of it. So for today, we're going to jump into this chunk. We're going to look at the topographical anatomy. When we talk about topographical anatomy, this is referring to a lot of the general kind of structures, like the way things that are put together, and some of the more landmarky type stuff is what I would say. And we're going to start with the planes of the body and the anatomical terminology. So there are 4 planes, technically 6 if we count the technically 5 if we count the 2 types of sagittal planes. However, but what's most important with the planes is understanding where they're located and then connecting them to the specific types of movement. What types of movement happen in each of our planes of motion? So sagittal planes, we have the sagittal plane, which runs straight through. So think right through the face, through the nose. We have the coronal plane, which cuts us front to back. We have the transverse plane. This is also called the axial. It can also be called the horizontal plane. And that divides the body into superior and inferior parts. And then the oblique plane, very, very rarely will you ever see a question on the oblique plane. It's just any other plane that you can draw in any other direction, slicing the anatomy. But again, we're not really going to use that or get asked about that. The sagittal plane is split up into 2 types of sagittal planes. There's the mid-sagittal plane or the median sagittal line, and that is perfectly dead center, straight up and down, equal left and right halves. Then we have parasagittal, which is unequal left and right parts. So you can see here the mid-sagittal straight in the middle, parasagittal will be off to the side, and you can make these cuts all the way over that you want. This is actually, these planes, this is how we look at MRIs and a lot of times CT scans. We can look at them from these different planes and kind of go and look at the different slices. And that's really what we're talking about with these planes, is the slices of the body. So we just want to know each of the types, kind of general, what they divide the body up into. Of course, we have our directional terms. Being in any kind of doctorate program, you should have learned all of these. Superior is towards the head, it goes upwards. Inferior is down towards the ground. Anterior or ventral, towards the front of the body. posterior or dorsal towards the back of the body. Think like dorsal fin. Medial, it's closer to the midline of the body, so kind of approaching that median line, like the sagittal line. Lateral, you're going further away from the midline. Proximal, this is going to be closer to the attachment or origin. So we're going like from the appendages. Proximal is going to be closer towards the main body. Distal is going to be further away from the main body. Superficial, more on the surface. And deep, this is away from the surface. So like superficial would be the skin. Deep to the skin is the fascia. Deep to the fascia is the muscle, and so on. Deep to the muscle is the bone. That's the kind of terminology that we use. Movement terms. This is where I want to point out the super important part, matching the movement to the plane. Because these are some of the questions that you don't usually think about, but that you can get asked in part 1. So for example, flexion. Flexion is going to be decreasing the angle between two body parts, and that is in the sagittal plane. Extension, this is increasing the angle, again, sagittal plane. You'll see that each of these movements kind of have a pairing that they like to be in. So flexion, extension, sagittal plane. Abduction and adduction, abduction, adduction, are our frontal coronal plane. So it's moving along that frontal coronal plane. Rotation is a transverse or axial movement. The way that I can kind of compare this is if you were to select a specific point along this whole plane and just put a single pin in there attached to an arm, which way would the arm swing? So with the sagittal plane, if I stick it into the sagittal plane, that's going right along this way, then it's going to be able to swing forwards and backwards, anterior and posterior. So that is going to be our sagittal plane movements. It's our flexion and our extension. So we look at that, flexion, extension, moves along that same sagittal plane. Abduction, adduction, the coronal plane's going this way. I stick a pin going anterior to posterior. If I want to move along that pin, it has to move up and down like that. Superior, inferior, that's going to be our coronal plane movements, abduction, adduction. Rotation, think about how a lot of people, they go to crack their lumbar spine and they do a little twist. That's kind of that transverse, where the pin is on that transverse plane and we're rotating around it. Sometimes they might get fancy and they'll ask about circumduction. Circumduction is like with your elbow or with your arm, your shoulder joint, doing the full rotation all the way around, or like your thumb can do full circumduction. That's all of the different planes. Pronation, hands going down like that, rotating downwards. That's also transverse axial plane. Going up, supination, like you're asking for soup. That is our transverse axial plane as well. I'm going to keep these videos relatively short, just as there's lots of different sections, and some of them are going to end up being quite a bit long just because of the quantity of material. But that is our first chunk, the planes of the body and the anatomical terminology.